So we generally think of gender, sex, and sexuality as being discrete but related concepts. We know it's a lot more complicated than that, though. Sex is arguably the most simple to understand as it relies on anatomy and physiology. Gender, though, includes one's gender identity, so how they think about themselves and their gender expression or how they present within their environment, and that may change depending on the environment. And then sexuality includes both sexual and emotional attraction as well as sexual behavior, and those things may or may not align. So while that, the previous slide showed the kind of three overlapping kind of concepts, here we see it as much more complicated than that. This is a nice illustration for how to conceptualize sex, gender, and sexuality and how they may or may not relate to each other. So really, if you think about each of them existing on a spectrum that may change over time for a person, or it may be more fluid, on a day-to-day, week-to-week, month-to-month basis. And just to point out that as healthcare professionals, the importance of biological sex or sex assigned at birth, it might be relevant to us, but it may also be a real source of shame or hatred for the person that we're treating. So it's just important that we're aware of that, especially if we want to provide the best care to our patients.